And let's stay in the province. The economic hub of the country hit with a third wave of COVID-19. I discuss this now with Professor Alex van den Heever, specialist in health economics and finance at the Wits School of Governance. Prof, thank you so much for joining us. Gauteng is densely populated, the economic hub of the country. People are moving in and out of this province all the time. Do you think it's inevitable that Gauteng is going to tip the whole country into a state of third wave soon?
I don't necessarily think that that will happen. I think that there are certain conditions in Gauteng which place it at a higher risk of a larger wave than some of the other provinces. And that would largely emanate from the fact that they were kind of spared some of the impacts of the second wave because of the timing of the restrictions that came in. So there's still quite a large population that is susceptible to infection relative to provinces like the KwaZulu-Natal, Eastern Cape and the Western Cape. So it won't necessarily result in a rise in those provinces. But the question really is how severe will it become in Gauteng itself?
Yeah, and I think that the concern is that a lot of people are behaving as if COVID is over. We know that enforcement of wearing masks is not possible everywhere, so it's up to the individual. But we also know that on certain forms of public transport, commuters are simply not wearing masks, for example. How are we going to get a very exhausted public from all these measures back on board for the third wave?
It's difficult to say, because what would really prevent a third wave from happening would be, for instance, protecting various forms of mass bulk transport and also indoor events, and making sure that people observe reasonable protocols in those places. And just the observance of reasonable protocols might keep transmission at relatively low levels. But I think what happens is people just start believing it's not there anymore, and the risk is not there, and they see other people ignoring the issues, and then they behave the same. And I think that we are probably seeing some of the effects of that. And then as prevalence starts to rise, more and more contexts where people are relaxed end up with somebody in that room or that vicinity who are infected, and accelerated transmission occurs. So when it becomes lax like that, the problem becomes that government has to step in, potentially. But we can't really step in a way that will harm the economy. So we have to have much more targeted interventions that focus on gatherings and super spreading events. But we will probably have to seriously consider them if the trend continues in Gauteng like this.
Yeah, and as we're talking about restrictions, it was interesting. I spoke to Business Leadership South Africa's CEO, Busi Mavuso, last night, and she was saying the business community feels very strongly that business knows how to be compliant. They know how to keep their patrons safe. They do not believe a tight curfew is of any use. They do not believe that alcohol bans, cigarette bans are going to work in any way. Do you agree with them?
I think that to the extent that the restrictions focus on gatherings, they will have an impact. And the question really is whether you can focus on gatherings without impacting on the economy. And I think that that's the balance that has to be struck. Adherence to protocols is very important, but also adhering to the necessary protocols. I think people are still in the mode of saying if you kind of wipe a surface down, you're okay. The problem is you've got to deal with the airborne features of this epidemic and deal with them completely. I do believe that they are correct, that a large number of businesses are able to minimize risk successfully. And I think it's also important to note that a lot of restaurants remained open in December when the restrictions were introduced. They weren't closed. Supermarkets were left open, and the epidemic was curtailed. So if we get the focus right, our businesses stay open. And I think we do have to look at that balance. We probably have to start thinking now about what we would do as restrictions. I would also just note that the generalized alcohol prohibition, which was definitely an overreach in December, did have the impact potentially of closing down high-risk settings as an indirect effect, shebeens, pubs, etc. But restaurants remained open. Now, that will have an effect, and curfews can have an effect. along those lines. But the question is whether we can look at what they did to still curtail the epidemic, do something different that's much more targeted and much more limited in its economic impact. I really do think we have to get that formula right.
Yeah. You know, this is not our first rodeo, it's not our second rodeo, it's our third rodeo, and we have learned clear lessons. As you say, business knows what to do, but there's still big gaps in what we should be doing. I'm wondering whether we should also be looking at restricting movement in and out of the province a little more, because that surely will help curtail the spread to other areas of the country at the very least.
I don't really see that as a major issue. I think even if somebody who's infected goes to another area, the question is really whether they have a large susceptible population. So in other words, what have the historical waves done to the number of people who are at risk of infection? And the second issue is what are the risks associated with super spreading? That is actually what you have to contain, rather than the fact that you're going to seed the epidemic in some other area. And that's where the focus should be. I mean, I still notice consistently on the roads that taxis drive with windows closed. People are inconsistently wearing masks. If there is one infected person in that taxi, they're going to infect everybody else.
Yeah.
And that is just routine, thousands and thousands of people every day transported in that. And as the prevalence rises, so that transmission risk will increase in effectively transmitting the epidemic. So those are areas you don't have to shut down the taxi industry, just open a window.
Yeah.
And it's those measures that, if we get them right, will at least keep us at a low levels of transmission while we get the vaccine program going.
Well, exactly. I mean, the vaccine program, this is the worst sort of confluence of timing in a way, because on Monday we're going to start vaccinating the over 60s. The last thing we want is a lot of elderly people having to come out to join long queues to get vaccinated. I know that the plan does involve going to the elderly and trying to reach out to them, but surely we need to be more urgently looking at more smaller targeted areas for vaccination, break those big groups up to avoid super spreaders.
I think that the vaccine venues will be reasonably protected in sort of well-ventilated spaces, and if people are queuing, it can be in open air. But the problem really will be accelerating the process. It's a real pity we didn't begin in February with AstraZeneca and with Novavax, which we would have had available to us. So we've missed out on actually just inoculating high-risk populations early on, before that's what a lot of people were saying, before the winter comes, which is going to be a higher systemic risk for transmission. But we are where we are. So I think that the issue is really getting up to scale as fast as possible and getting on with it. But there are a lot of uncertainties about how many doses are actually available, and whether or not, even if we get to scale, whether we're going to run out of doses while we wait for the next tranche. It's just unclear when everything's coming through.
Absolutely. Well, thank you so much for chatting to us this evening. That was Professor Alex van den Heever, Specialist in Health Economics and Finance at the Wits School of Governance.